We'll move on to the next presentation, which will be given by Dr. Jansen from the University Hospital Maastricht. The title is fMRI reveals decline activation of prefrontal cortex in epilepsy patients on topiramate.
Okay. Thank you for your introduction. In this study we have investigated the effect of the anti-epileptic drug topiramate on the cognition of patients with epilepsy using functional MRI and neuropsychological testing. A major way to treat epilepsy is using medication. If you look at anti-epileptic drugs, there are two profiles very important. One is the efficacy profile, which indicates how well a drug prevents seizures, and the other one is the tolerability profile, which says something about the side effects that are induced by the use of the anti-epileptic drug, and particularly the cognitive side effects. And often a dilemma occurs during treatment. Often a dilemma occurs during treatment when sufficient seizure control can only be achieved with medication that induces cognitive impairment. So we've chosen to study topiramate. Topiramate is a relatively new anti-epileptic drug, and it is known for its beneficial efficacy profile. However, it is also known that it induces cognitive impairment, such as mental slowing and aphasia, which means word-finding difficulties. Furthermore, it's known that the retention rate after 4 years is about 30%, and the cognitive side effects were a major reason for patients to stop topiramate treatment. So we were interested in the effect of topiramate on the cognition of epilepsy patients. Therefore, in a small study we included 5 patients on topiramate therapy and 10 patients without topiramate therapy. All patients were in polydrug therapy, and furthermore the groups were matched on age, seizure frequency, pathology and drug load. The assessment consisted of neuropsychological testing using aphasia disorder test battery and functional MRI of silent word generation. From the test battery, a clinical neuropsychologist attributed a score from 1 to 5, which indicates how well the patients could perform the task, and the silent word generation was using a paradigm where the patients were lying in the MRI, and visually there were letters presented, and they had to come up with words that started with the letter presented. And after the scan session, the patients were asked to perform the task with another letter to check whether they were able to perform the task. For the functional MRI, we counted the voxels that were active within a predefined region that is essential for expressive language. We counted voxels that had an activation higher than a certain threshold, and this threshold was derived from the average activation level of the brain regions older than the language area. And on the left you can see the areas, the Brodmann areas we included for the language area. Here you can see the results. On the left you see the results from the neuropsychological test. As you can see, the topiramate group shows a significantly a lower language score than the control group. And for the fMRI analysis, it showed that the topiramate shows significantly less activated voxels within the language area than the control patients. to visualize where in the brain the activated voxels are located. You can see here functional MRI activation maps overlaid on coronal images. And as you can see in the control group, activation occurs in the left inferior prefrontal cortex, or Broca, here. And then the medial prefrontal cortex, the ACC, and the superior prefrontal cortex. If you look at the topiramate group, there are significantly less voxels active in these regions. So we were also interested in which regions display a larger sensitivity to the treatment of topiramate. We already knew from the last analysis that topiramate induces a generally lower activation throughout the whole brain. Therefore, we wanted to know which brain regions display the largest or the smallest differences in activation level between the topiramate group and the control group. Therefore, we used a voxel-by-voxel based analysis to calculate the deviation from the average activation difference level. This analysis revealed that both the Broca and the ACC display a larger than average activation decline, whereas the occipital cortex has regions with both a lower and both a higher activation decline than average. So, we've shown using functional MRI that the language areas in topiramate patients are underactivated during a silent voice generation task, and this is in accordance with neuropsychologically assessed aphasia. Furthermore, the prefrontal language-related areas seem to be more sensitive to topiramate treatment. And we hypothesized that the GABAergic effect of topiramate may play an important role in all of this, because it's known that GABA is the major inhibiting neurotransmitter, and it's known from spectroscopic studies that the brain GABA level increases due to topiramate treatment. Furthermore, it's known that from preclinical studies that disruptions of the GABA neurotransmitter system result in disturbances of the frontal lobe. However, our study has several limitations. Therefore, are we sure that we can say that the topiramate causes the observed effect? First of all, we have a cross-sectional design and only a limited number of patients. Furthermore, other language and cognitive tasks are needed to confirm our results. However, we think that there is an obvious correspondence between the type of cognitive language impairment and the regions that show a declined activation, namely the ACC and Broca. Therefore, we think that topiramate plays an important role in the origin of the cognitive impairment. So to conclude, our present findings help to visualize the cognitive impairment induced by topiramate, and this shows again that the tolerability profile of topiramate is very important, and since topiramate is not only used for epilepsy patients but also in other neurologic diseases such as migraine, it shows that the tolerability profile of topiramate is relevant in other diseases as well. Thank you for your attention.